Your colon literally gives you warning signs before cancer develops. It's either you do not know the signs or you just ignore them. Colon cancer is the second leading cause of death in the United States of America, and it doesn't have to be. Most colon cancers start as polyps, which are abnormal growth in the lining of the colon. If you catch these small polyps early, you can get them taken off and there is no cancer. But if you miss these small polyps, you get into a completely different conversation. Warning signs for colon cancer. The first thing you want to watch out for is blood in your stool. It could be bright red blood or dark stools. If you even notice abnormal changes in your bowel pattern or abdominal pain or cramping that does not resolve after a few weeks, that's a warning sign. Other signs include unexplained weight loss and feeling like your belly is not fully emptied. These are signs that should not be ignored. None of them is normal. Who is at risk of colon cancer? If you have what is called inflammatory bowel disease, either the Crohn's disease or the ulcerative colitis, you are at more risk of developing colon cancer than the average person in the population. If you also have a first-degree relative who had colon cancer or an advanced polyp, especially before the age of 60, you are at increased risk. Of note, these people who are at increased risk need to be screened before the age of 45. If you also have a family history of Lynch syndrome or familial adenomatous polyposis, you need to let your doctor know because you should also be screened earlier. There is this group of people who are at a higher risk of developing colon cancer, and as a matter of fact, they die earlier than other groups. That is not even talked about, and it's the Black Americans. This disparity that I just talked about is real, it is documented, and it even makes early screening more crucial. Now let's talk about screening. In the United States of America, the American Cancer Society, as well as the USPSTF, have recommended that colon cancer be carried out in average risk individuals at the age of 45. It's no longer 50. And colonoscopy is the gold standard. There are other options for screening. Some of the options include a FIT test. This is a stool-based test that you can do at home and is usually done annually. You can also do Cologuard. It's also a test that can be done at home and it's usually done every 3 years. Another option is CT colonography. This test is done every 5 years. Now your doctor can definitely help you to figure out which one fits your situation. Colon cancer gives warnings. Polyps do not hurt. When you do your screening, you find them before they become cancerous. And that's the whole game.